Hello, my friends. I'm Dr. Linda Parker, cardiologist and cardiovascular health specialist. And today, we're going to have one of the most urgent and potentially life-saving conversations about medications that millions of people take daily, believing they're protecting their heart health. But that may actually be causing devastating side effects that your doctor never adequately explained to you. I believe it's time to bring this critical medical information to light with alarming scientific evidence that the pharmaceutical industry and conventional cardiology prefer not to communicate clearly to patients. Because when we understand the real risks, the hidden side effects, and the safer alternatives for certain blood pressure medications, we don't just protect our health. We make truly informed decisions that can literally add years to our lives and life to our years. So, welcome back to this space where patient safety supersedes pharmaceutical profits, where medical truth overcomes industry interests, and where your right to informed consent is more important than maintaining prescribing habits that may no longer serve your best interests. Whether you're taking one blood pressure medication or multiple drugs, this information could be crucial for your long-term well-being and quality of life. Because here's the alarming truth I've observed in thousands of patients during 22 years of cardiology practice, and that emerging research continues to confirm with increasingly concerning data. There are 5 specific classes of blood pressure medications, routinely prescribed to millions of patients, that cause side effects so devastating to quality of life and long-term health that every patient taking them should immediately schedule a consultation with their doctor to discuss safer, more appropriate alternatives that can control blood pressure without destroying vitality, energy, and overall wellness. Now, let's go directly to the 5 blood pressure medication classes that have me deeply concerned after more than 2 decades of observing their effects on patient health, quality of life, and long-term outcomes. The question I constantly receive from patients is this: "Doctor, I've been taking blood pressure medications for years, and I feel progressively worse, more tired, less mentally sharp, reduced vitality, and multiple side effects that seem to be multiplying." But when I mention this to my doctor, they just say these symptoms are normal for my age or part of having high blood pressure. Could the medications themselves be causing these problems? Are there better alternatives that won't make me feel so terrible? What should I be questioning about my current treatment? This is the desperate consultation that arrives from patients whose quality of life has been destroyed by their blood pressure medications, comes in emails from people seeking answers their doctors won't provide, and reflects the frustration of millions who've been told to simply accept feeling terrible as the necessary price of blood pressure control. I want you to stay for this complete medical revelation, because by the end, you'll have specific information about which medications to question, why they're problematic, what alternatives exist, and exactly how to have this conversation with your doctor in a way that gets results and protects your health. All right. Let's start with the medical reality that few cardiologists communicate honestly to their patients. Not all blood pressure medications are created equal, and what might be appropriate for one patient can be devastating for another. The problem is that conventional cardiology operates with standardized protocols that don't adequately consider individual factors like age, gender, lifestyle, and quality of life priorities. But as with all aspects of personalized medicine, the specific medication class, the individual patient characteristics, and the risk-benefit analysis for each person's unique situation are absolutely crucial for optimal outcomes. Generic prescribing based solely on blood pressure numbers, without considering the whole person and their quality of life, often leads to medications that control numbers while destroying well-being. So let's start with the fundamental question every patient should ask. Which 5 blood pressure medication classes should you question immediately with your doctor? What makes them problematic for certain patient populations? What are the specific side effects that destroy quality of life? And most crucially, what are the safer, more appropriate alternatives that can control blood pressure without devastating side effects. Let's start with the 5 blood pressure medication classes that warrant immediate questioning with your doctor, ordered by severity of quality of life impact. Medication class number 5, alpha blockers, prazosin, doxazosin, terazosin. These medications were once commonly prescribed for blood pressure but are now recognized as having significant side effects, including dizziness, fatigue, and especially dangerous for elderly patients due to orthostatic hypotension. Sudden blood pressure drops when standing that cause falls and fractures. The research shows that alpha blockers increase fall risk by 68% in adults over 65, and falls are a leading cause of serious injury and mortality in this age group. Additionally, they cause persistent fatigue that patients often attribute to getting older when it's actually medication-induced. If you're taking an alpha blocker primarily for blood pressure control, you should ask your doctor about transitioning to safer alternatives like ACE inhibitors or ARBs that don't carry the same fall risk and don't cause the debilitating fatigue. Medication class number 4, non-selective beta blockers, propranolol, nadolol. While selective beta blockers can be appropriate for specific conditions, non-selective beta blockers cause systemic effects that go far beyond blood pressure control. They slow metabolism, cause weight gain, trigger depression, reduce exercise capacity, and can worsen asthma and diabetes. The metabolism-slowing effects are particularly devastating. Patients often gain 15 to 20 pounds within the first year and develop insulin resistance that can progress to full diabetes. The depression risk is also significant, with studies showing 40% increased risk of clinical depression in patients taking non-selective beta blockers. For patients without specific indications like certain heart conditions, there are usually better alternatives that control blood pressure without these systemic metabolic and psychological effects. Medication class number 3, thiazide diuretics, hydrochlorothiazide, chlorthalidone. Especially problematic for men over 60 and anyone with active lifestyles. While thiazide diuretics are often recommended as first-line therapy by guidelines, they cause devastating side effects that significantly impact quality of life and long-term health. These medications force the kidneys to eliminate not just sodium and water, but also crucial minerals including potassium, magnesium, and zinc. This mineral depletion causes chronic fatigue, muscle weakness, cramping, and in men specifically, severe sexual dysfunction due to reduced blood flow and depleted minerals needed for testosterone production. For men over 60, the sexual side effects are particularly devastating. Up to 70% experience significant erectile dysfunction that doctors often don't warn about or attribute to aging when it's actually drug-induced. The chronic dehydration also accelerates kidney function decline, which is especially dangerous for older adults. Studies show that thiazide diuretics increase diabetes risk by 23%, disrupt electrolyte balance in ways that can trigger dangerous heart rhythms, and cause metabolic problems that counteract their blood pressure benefits. If you're taking a thiazide diuretic and experiencing fatigue, sexual problems, muscle issues, or metabolic changes, you should immediately discuss alternatives with your doctor. ACE inhibitors, ARBs, or calcium channel blockers often provide equivalent blood pressure control without these devastating quality of life effects. Medication class number 2, centrally acting agents, clonidine, methyldopa. These medications work by suppressing signals in the central nervous system, which sounds problematic because it is. They cause severe sedation, brain fog, depression, and dangerous rebound hypertension if doses are missed. The cognitive effects are particularly concerning. Patients describe feeling mentally dulled, having difficulty concentrating, and experiencing memory problems that can be mistaken for early dementia. In elderly patients, These medications can significantly accelerate cognitive decline. The rebound hypertension risk is also dangerous. If you miss even one dose, your blood pressure can spike to dangerous levels, potentially triggering strokes or heart attacks. This makes these medications particularly risky for anyone who might occasionally forget doses. These medications should be reserved only for very specific, rare situations where no other options exist. If you're taking clonidine or methyldopa for blood pressure control, schedule an urgent appointment with your doctor to discuss safer alternatives. Medication class number 1. Combination pills with multiple problematic medications. The most concerning prescriptions I see are combination pills that include 2 or more of the problematic medication classes we've discussed, for example, a thiazide diuretic combined with a beta blocker. These combinations multiply the side effects, create complex drug interactions, and make it impossible to adjust one medication without changing everything. Patients on these combinations typically feel terrible, but don't know which medication is causing which problem. The pharmaceutical industry loves combination pills because they're convenient and increase compliance, but they're terrible for personalized medicine and optimizing individual patient outcomes. Let me give you a specific example that illustrates these problems. A 68-year-old patient came to my office completely exhausted, mentally foggy, and frustrated. He'd been on a combination pill containing hydrochlorothiazide and metoprolol for 5 years. His blood pressure numbers were perfect, but his quality of life had been destroyed. He'd gained 25 pounds despite eating carefully, had zero energy for activities he used to love, suffered from erectile dysfunction that was destroying his marriage, and felt mentally slower than ever before. His previous cardiologist had told him these symptoms were just part of getting older and refused to consider changing his medications since his blood pressure numbers looked good. I worked with him to gradually transition to a single ACE inhibitor, lisinopril, that controlled his blood pressure equally well without the devastating side effects of the combination pill he'd been taking. The results were extraordinary. Within 6 weeks, his energy began returning, and the brain fog started lifting. Within 3 months, he'd lost 15 pounds without changing his diet. His sexual function had significantly improved, and his mental clarity had returned. Within 6 months, he felt 20 years younger, while maintaining excellent blood pressure control. His transformation came not from adding new medications or supplements, but from eliminating problematic medications and replacing them with more appropriate alternatives for his specific situation. This story isn't unique. I've seen hundreds of similar transformations when patients transition away from problematic blood pressure medications toward more appropriate alternatives. The safer alternative medication classes that often work better with fewer side effects include alternative number 1, ACE inhibitors, lisinopril, enalapril, ramipril. These medications control blood pressure without eliminating essential minerals, don't interfere with sexual function, and can actually improve erectile function by improving endothelial function. They're generally well tolerated with minimal side effects beyond occasional dry cough in some patients. Alternative number 2, ARBS, angiotensin receptor blockers, losartan, valsartan, telmisartan. Similar benefits to ACE inhibitors but without the cough side effect. Some studies suggest they may even improve sexual function rather than worsening it. They're particularly appropriate for patients who couldn't tolerate ACE inhibitors due to cough. Alternative number 3, calcium channel blockers, amlodipine, diltiazem. Effective blood pressure control without the metabolic, sexual, or cognitive side effects of the problematic medication classes. They may cause mild ankle swelling in some patients, but this is generally manageable and doesn't impact quality of life significantly. Alternative number 4, natural approaches under medical supervision. For some patients with mild to moderate hypertension, lifestyle modifications including specific dietary changes, DASH diet, reduced sodium, increased potassium, regular exercise, stress management, and targeted supplementation can significantly reduce or even eliminate medication needs. My urgent medical recommendation: if you're currently taking any of the 5 problematic medication classes I've discussed, schedule an appointment with your doctor within the next 2 weeks to discuss whether these medications are truly the best options for your specific situation. Important: never stop blood pressure medications abruptly without medical supervision. Sudden discontinuation can cause dangerous blood pressure spikes. The transition to alternative medications must be gradual and carefully monitored by your physician. Prepare for your appointment by documenting all side effects you've experienced since starting your current medications. Many doctors don't connect symptoms to medications unless patients present this information clearly. Write down every symptom: fatigue levels, cognitive changes, weight changes, sexual function problems, mood changes, sleep quality issues. Bring this list to your appointment and explicitly ask, are there alternative blood pressure medications that might control my blood pressure equally well without these side effects? Be specific about which symptoms are most impacting your quality of life. If your doctor is dismissive or refuses to consider alternatives despite significant quality of life impact, it may be time to seek a second opinion from a cardiologist who practices more personalized, patient-centered medicine. The medical reality is that blood pressure control is important, but it shouldn't come at the cost of destroying your quality of life, energy, mental clarity, and vitality. There are almost always alternatives that can achieve good blood pressure control without devastating side effects. Your quality of life matters as much as your blood pressure numbers. Don't accept feeling terrible as a necessary price of treatment when better options exist. And before we close, I want to mention something crucial for people who are considering making this important medical transition, but want to ensure they're supporting their cardiovascular system optimally during the process of changing medications. Transitioning away from problematic blood pressure medications is essential, but the process can be optimized significantly with specific nutritional support that naturally supports cardiovascular health while reducing dependence on problematic pharmaceuticals. That's why I recommend 2 natural support options that perfectly complement the transition towards safer blood pressure management. For people who want gentle support during medication transition, I recommend organic watermelon extract, rich in natural L-citrulline. It supports natural vascular function, improves nitric oxide production that helps regulate blood pressure naturally, and provides cardiovascular support during the transition process. But if you're looking for complete cardiovascular support, not just during transition, but also enhanced energy, improved circulation, and comprehensive heart health optimization, then I recommend the Advanced Cardiovascular Support Formula. It combines Icarian from horny goatweed for vascular support and enhanced circulation, Tonkat Ali for energy restoration and cardiovascular resilience, fenugreek for sustained energy and metabolic support, nettle root for mineral balance and cardiovascular health, and concentrated L-citrulline for maximum nitric oxide production and blood pressure support. Together, these ingredients support complete cardiovascular health while helping your body transition away from problematic medications towards safer alternatives. You'll find both options linked in the pinned comment and video description below. Make the intelligent transition away from medications that destroy your quality of life with nutritional support that optimizes your cardiovascular health, because you deserve blood pressure control without sacrificing your energy, vitality, and quality of life. For persistent symptoms, consult a professional.